First, we're going to start with Dr. Melanie Castillo. She is an endocrinologist at DHR Health. Dr. Castillo, I would like to start with you. Can you describe to us the burden of diabetes among the Rio Grande Valley community?
Thank you, Dr. Mego, of course, and welcome everyone. So definitely diabetes is a problem. It's a worldwide problem, and we know that it's one of the main factors that drives the first cause of death in the world, which is cardiovascular disease. So we know the prevalence of diabetes in all Texas is around 12 to 13%, but here in the Rio Grande Valley is around 30%. So some statistics said that in 2050, around 50% of the population will be diabetic. So that means 1 in every 2 people here in the valley. Right now, it's like 30%, so that would 1 in every 3 around that. So it's a big problem. And but the good news is that nowadays we have a better way to diagnose it in a faster way. And we are getting more awareness of what pre-diabetes looks like. So the first step of becoming diabetic, we can detect it there and we can do something about it. So diabetes is a disease that is easy to diagnose. Like I said, we have different tests. We have, there's this test that are run every time that patients go to a general visit with their primary care physician. So we know that if a patient has an A1C, which is the average of their blood sugar for the past 3 months, and if they have an A1C that is more than 6.5, the patient is already diagnosed with diabetes. We have other ways to diagnose the patients, like if they come with a fasting blood sugar of more than 126, that's another that's another way to diagnose it. Or if they do a glucose tolerant test, which they will give something that is very sweet. They will check the blood sugar after an hour, and they can determine if the blood sugar goes more than 200, the patient is diabetic. So there are many ways that we can diagnose. And like I said, it's a disease that we have to be on the look for because it affects all of our population. And on top of everything, we're seeing the age of diagnosis of diabetes is becoming younger and younger. So when I studied medicine, when I graduated from medical school, it was not so long ago. So diabetes was a disease that type 2, you will only see in adults. But nowadays we have kids, like 5, 6 years old kids that are already diagnosed with diabetes, and obesity is one of the main factors. So it's a disease that affects the valley because of our heritage, Hispanic heritage, because of the food or also the lack of activity. But it's something that we definitely have to be on the look for.
Thank you. Such important information. Can you tell us a little bit what are the current recommendations to monitor diabetes complications? I mean, how frequently we need to see an eye doctor, a podiatrist, if there is any current recommendations at this time?
Yeah. So once the patient is diagnosed with diabetes, we always have to make sure that we are preventing those complications from happening. So we know that the major complication from diabetes is cardiovascular disease. We also have to make sure that the patients, like the end organs, are affected by diabetes, such as the eye, neuropathy. So we want to make sure that we see our eye doctor at least once a year. And
Dr. Aspurua, can you, as a cardiologist, could you describe how poorly controlled diabetes could affect your heart?
Definitely. Thank you, Dr. Mego. Well, diabetes is a very well-established risk factor for cardiovascular problems. And it's actually considered an equivalent. If you have a patient that has diabetes, you treat them as you consider them as having coronary artery disease as well.
And if you suspect somebody who has already affected coronary artery disease, let's try to focus only on coronary artery disease in the heart. What are the steps, or what diagnosis do you do in this population?
Definitely. So we have to be clinically suspicious about it. And there's nothing like talking to the patient and hearing their symptoms. That's the first step. And we start with talking and seeing what symptoms do they have. Mostly if they're having shortness of breath, if their functional capacity is decreasing, if they're not able to do the same things that they were doing, a few months ago or a year ago, because they get tired, they get short of breath, or they have chest pain, mostly, on exertion when they're doing physical activities.
Dr. Ponce, as a nephrologist, could you describe how poorly controlled diabetes can affect your kidneys?
Yes, thank you, Dr. Mego. Well, this matter, as it is for other specialties, is very dear to me, as diabetes is the first and primary culprit for kidney disease. Diabetes will cause a slow decline in kidney function. Understanding that patients manage high levels of glucose, this glucose will later be filtered and it will alter the hemodynamics inside.
And can you tell us about the current recommendations to prevent worsening of kidney function, as well as any treatment in patients who already has advanced kidney disease?
Yes. So over the standard of care that we have for years, ACE inhibitors, ARBs, medications that target this concept of hyperfiltration that reduce the pressure inside the kidney, we have new medications coming along and helping us target other parts of the kidney, reducing pressure. By reducing the pressure, you reduce the amount of protein that is being lost.
I am Dr. Pedro Mego from Mission Vascular and Vein Institute. And when we talk about diabetes, it's important to remember that diabetes provides a systemic compromise. Diabetes will induce atherosclerotic development and will accelerate the progression. But what is atherosclerosis? That Dr. Aspurua mentioned is this disease in which the body will form a lipid inflammatory build-up inside the arteries. And these arteries are going to get narrow, and several times they will get occluded. And these blockages that happens in the arteries usually are systemic. When with these arteries affects the heart, we call it coronary artery disease, and Dr. Aspurua explained it very well, and put the patient at risk for heart attack. If this compromise the neck, we call it carotid artery disease, and we'll put the patient at risk for a stroke. And if these arteries compromise in the legs, we'll put the patient, we call it peripheral artery disease, and we'll put the risk a patient to the amputation. The way how we diagnose, it comes in several stages. Obviously, we try to get the information from the patient, the level of activity. Before I was able to walk 5 blocks, now hardly can walk half a block. That we call it claudication. Also, we go in the physical examination. But when we go by testing, there are simple tests called anchor brachial index that several times is done in the primary care office. And this is the way how we diagnose this peripheral artery disease. Is basically we check the blood pressure in the calf, blood pressure in the ankle, a simple mathematical formula, and if this is less than 0.9, we diagnose it, this disease. A step further is to do a lower extremity arterial Dopplers, a test that doesn't compromise, doesn't provide any radiation, no needles, and will provide very good information about the circulation in the legs. And if we go by next step, it's an invasive test called a lower extremity angiogram, in which we put usually a small needle in the groin. Usually we pass the catheters to the opposite leg, to the compromised leg. We inject a small quantity of iodine contrast, and we'll check the artery from the inside. If we confirm that this is narrow, and obviously the patient needs it, we'll try to revascularize most of the time in the same setting. Dr. Inu, as a podiatrist, could you describe how poorly controlled diabetes affect your feet?
Thank you, Dr. Mayo, and the Rio Grande Valley Diabetic Association for inviting me here, and I'm extremely happy to participate in this meeting. Usually what I tell my patients is your foot is a mirror or manifestation of what's wrong in your body. And that is very true when it comes to diabetes. meaning a poorly controlled diabetes leads to impairment of your circulation, impairment of your nervous system, and then those issues will manifest in your foot in a little bit differently. One is you start developing just randomly callus or hardened skin in your foot. Two, you start developing a wound that doesn't heal. And the reason is what it does, as other experts mentioned, diabetes alter your circulations and also it damages your nerves. So you stop feeling any kind of sensations. So once you don't have these sensations, you can't protect your foot from any kind of harm. Pain is good, but unfortunately in diabetic patients, they say, I don't feel anything, which is very scary, meaning you can't have any kind of cut in your foot. You can wear just really small size shoes and develop a blister. You can have even wounds deep to the bone and you don't feel anything. So those all are manifestations of a poorly uncontrolled diabetes. And it is very vital for patients to realize the effect of diabetes in their foot. Once you see it in all those characteristics in your foot, it is really kind of advanced stage. So that's how it manifests.
Dr. Hernandez, as a wound care specialist, could you describe how poorly controlled diabetes affect the wounds?
Thank you so much, Dr. Mego. Thank you so much, all of you, for being here today, for having me. So definitely the diabetes is a very detrimental risk factor in wound healing. Whenever I see a patient or whenever a patient comes to me or is sent to me by the primary care physician due to a wound that hasn't healed, 90% of those patients will have diabetes. So whenever they get to me or to any other wound care doctor, what we're gonna see is that all the complications, cardiovascular complications, the peripheral vascular disease, we're gonna see the kidney disease already in a very advanced stage. All those contribute negatively to the wound healing, as I mentioned before. And what we see is usually wounds that are infected and wounds that are deep infected to the point in which the bones and the deep tissue are already compromised. And in our daily practice, we see these patients, and not only diabetic foot ulcers, but also venous ulcers, arterial ulcers, pressure injuries that are affected directly by the poor controlled diabetes.
How do you diagnose the severity of the wounds that could be affected by diabetes?
As a wound care specialist, it's my duty to diagnose how deep or how severe are the complications that the patients are experiencing. And usually, like we were mentioning before, we're gonna go for vascular studies to see if we have proper circulation so we can heal the wounds. We're gonna check the nutritional status of the patient to see if they have enough vitamins and minerals to heal those wounds. We're gonna check, of course, how the diabetes is, if it's well controlled or not, because that's a very important factor in all that we were talking about. And also we can try to see with images such as X-rays, bone scans or MRIs, if the deep structure have been already are being affected.
Andy, as a dietitian, could you describe why an appropriate diet is the cornerstone in the prevention and management of diabetes?
Thank you so much, Dr. Mego, for that great question. I want to also say just thank you for everyone that is joining us this evening. I know it's cold out, and so it's just really great to see your interest and then also dedication to learning more about this disease that is affecting so many families here in the Rio Grande Valley. So to answer your question, I think most of us on this panel have already echoed how important nutrition is. As a registered dietitian, nutritionist for over 15 years, it's quite sad that we're seeing children that are being affected by this condition, this disease early on. And I think when we think about prevention, I also want to touch what Dr. Hernandez just talked about. It's really important that the information that I share with you today also takes into consideration the patient's ecosystem. So what I mean by that is that, in a traditional diet, the American Diabetes Association does recommend that a diet should be balanced, should include more fruits, more vegetables. And you might be asking why. Well, fruits and vegetables are full of nutrients and vitamins that help protect our bodies. But then one key ingredient as well, which is fiber, which has a lot of benefits when it comes to managing blood sugar control. The other piece that I want to mention as well is that, we think of fruit and vegetable being so easily accessible, but it's not. And so it's a little difficult at times when you're talking to patients and we're telling them, you should be eating more fruits and vegetables, but it is really a key to a balanced diet. They say that anywhere between 9 to 12% of the US population is getting enough fruits and vegetables. So I think if I could share a message with everyone in the audience today, it's just encouraging more fruits and vegetables, managing your carbohydrate intake. So the American Diabetes Association does also recommend that. Good lean source of protein. We've talked a little bit about limiting salt, saturated fat, choosing foods that are, that include healthy fats such as monounsaturated fats. And so limiting foods that are processed also have been proven to increase the risk of diabetes management, and then also some of the other comorbidities that we talked about, such as obesity and then high blood pressure and whatnot.
We are living in an era that a lot of people consider themselves experts, and there are plenty of diets. What is your opinion? What is your opinion regarding keto diet, or intermittent fasting in the management of diabetes?
Yeah, so as a researcher myself, I think it's important to recognize that when we look at studies, intermittent fasting has been shown to be proven successful for some individuals. I also want to mention that diets such as keto has also been shown to be successful with some patients. But I also want to mention that nutrition is very individualized. We talked about the ecosystem. I cannot recommend XYZ for a patient if a patient doesn't have access to those resources. The other piece is sustainability, right? So we hear all this information on social media, on TV, from our friends, from our family, from our community. But if it's not sustainable, it's not really going to do what we need it to do long term to really protect our health, create those healthy, sustainable habits that we really do need to either prevent diabetes or manage diabetes.
Diet has failed, medications has failed. What are the surgical weight loss options to treat diabetes?
Thanks for inviting me. It's interesting that one of the best ways to treat diabetes is surgical. And let me just start a little bit with some history. 20 years ago, when we started doing bariatric surgery, it was basically weight loss surgery. And that was our advertisement. That was our goal. Lose weight, look better, feel better, socialize with your family, do this and that. And it was very effective. Little by little, we start looking at studies where not only the patient was losing weight, but their high blood pressure was improving, their liver steatosis was improving, and mostly striking, the diabetes was resolving. So after several studies and many things that we still don't understand, bariatric surgery is now not weight loss surgery, it's metabolic surgery, because it is used to help patients to lose their weight and to regain or to improve their health.
Can you tell us a little more about what surgical options are? We hear lap band, sleeve, bypass. Can you tell us a little more the difference and what you choose and why do you choose one compared to the other in diabetes?
Sure. Lab ban has come out of favor because it has not proven to be as effective. Most of the studies have been done on gastric bypass and sleeve gastrectomy, even though there's duodenal switch, there's mini gastric bypass. There are other techniques like gastric balloons that can help patients. But in order to be sure that we have enough data to represent the good procedure that is going to improve patients with diabetes, gastric bypass has proven to be the best. Secondary sleeve gastrectomy. These are done in a less invasive way, which is laparoscopic or robotic surgery. And they have been also proven to be not only effective, but safe.